This government meeting is brought to you by Eastworks and our local cable subscribers.
I'd like to make a motion to call the meeting to order, February 18th, 2026, Easthampton Health Department, Board of Health meeting.
I'll second that motion. All in favor? That's yes.
Steve, yes.
All right. Steve, I'm wondering if you wouldn't mind running the meeting today for me.
No, I don't mind.
Thank you.
Our
Go ahead.
first agenda item is public speak. 15 minutes.
We just have to read the opening remarks. Do you have access to those?
Airdrie, do you have that in front of you?
I'm ready. Can you hear me?
Yep, you can go ahead.
In accordance with Mass General Law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or topic for later discussion via email to the health@easthamptonma.gov email.
Thank you so much. So our first agenda item is public speak time for 15 minutes, 3 minutes per person. Ryan, I'm not sure if you can see who would like to participate.
Yes, we can start with Ken Elstein.
Okay, go ahead, Ken.
Thank you. Good to be back again. Ken Elstein, Belchertown Board of Health, and past president of the Hampshire County Select Boards Association. I saw on your agenda that you're going to be looking at regulations. It wasn't clear whether it was tobacco regulations or something else. We had talked before about nicotine-free generation, and I hope you move towards adoption when you're ready. I will remain on if you're going to be talking about tobacco regulations later, it's not clear. That's my whole speech.
Great, thank you.
Just to briefly address it, no plans to talk about regulations, Ken. The only thing we would talk about related to that would be it's possibly scheduling a hearing in the future, but no item bullet points to talk about any regulations tonight.
Oh, okay. Thank you. This is my third Board of Health meeting in the Valley in the last 24 hours, so I appreciate that. Have a good evening.
Thanks, Ken.
Thank you.
Thank you.
And we have one more for public speak, and that is Peter Brennan.
Hey, Peter Brennan here. Can you guys hear me?
Yes.
Yep, go ahead.
All right. I'm the executive director of New England Convenience Store Energy Marketers Association. We have several convenience stores in town, and we'd say that we were opposed to nicotine-free generation. I've sent over testimony. I know it's been received. I know the health director had told me that, he supports the nicotine-free generation, and we don't. We think it's a ridiculous policy. We think there's no data to suggest that banning adults from purchasing nicotine products in your town does anything to impact youth nicotine usage. So I hope you actually take a careful look at this, and you look at, any information that's available, scientific journals, really anything, and don't just try to make a emotional play to adopt a policy that has no practical impact aside from to harm our retailers and drive people from your town into other towns to buy their goods. Again, like Ken, I'm available to stick around and answer questions, but if you don't need me anymore, then I'll sit and listen. Thank you.
Thanks, Peter. And it looks like that is everybody for public speak.
Thank you, Ryan. Our Our next agenda item is to approve meeting minutes from November and December of last year. Beth, I didn't have any questions for November.
No,
I didn't see any changes.
Yep, I reviewed it. Looks good. I'll make a motion to accept the meeting minutes from November's Board of Health meeting.
I'll second that motion.
Uh,
All in favor? Steve, yes.
Beth, yes.
Motion.
I was not present at the December meeting, so I will have to abstain from voting on that.
Sure. Ryan, can I vote without Sam's approval? Does she have to sign off on it even though she's resigned?
That's a good question.
I think we can have a vote, and I'll just say abstaining out of
Abstain.
necessity, and that's the documented.
Action.
Yeah.
Okay. I'll make a motion to approve the December 10th Board of Health minutes. All in favor? Steve, yes.
Abstaining out of necessity, as I was not present at the meeting.
Great. Thank you very much. Item number 3, the mayor's office update. Thank you, Mayor Derby, for joining us. I wanted to congratulate you and have you give you the floor for a few minutes to kind of see where your leadership wants to take us in the next few years.
Great. Well, thanks so much for having me. And you know, I think that as far as I'm concerned, I'm pretty happy with the way that Ryan is steering the ship right now. You know, I think the things that are going to be pretty much in my purview that are pressing for me are really going to be the continued efficiency and expeditiousness of inspections around, especially around like food trucks as we come into the food truck season, and restaurants as we are going to be actively trying to onboard new restaurants in the near future. That's going to be, you know, a critically important role. And I know that there are so many other roles with the health department. You know, one of the things that I did early on as mayor was I got to be with Ryan and his team down at the Millside Park for a vigil around opioid overdose awareness and destigmatization, which was a really great event. You know, so I think that Easthampton's continued commitment to helping mitigate and prevent, you know, opioid and other hard drug issues in the city is critical work. And I know that that's just a small piece. You know, all the housing stuff that Ryan has to deal with, and like there's just, it's such a wide breadth of issues that need to be tackled. Like we didn't even talk about infectious disease. So let's hope, cross our fingers for no more outbreaks. But, you know, I also understand my role as mayor, which is relatively in the background, day-to-day operations, that, you know, the Board of Health is a relatively independent entity that is governed under state law and, you know, the Mass Department of Public Health. So I'm not planning to overstep my bounds. And so I think that that's hopefully that's a good thing for for the Board of Health. But I will be here to support. And I know there was questions around you know, potential social worker opening, and you know, we've been slow to fill that. We still do have a hiring freeze happening here at City Hall. And yeah, as I get into budget season, there's a good reason for that. And I'm really pleased to see former Councilor Riley step up and help fill some of the gap, which is just amazing. I think that's a really mutually beneficial situation. And I think, and I give credit to the health department to find creative solutions to help fill some of the needs. And also, I know that Ryan and I met with some of the other department heads and we're brainstorming ways that we could help support the health department with some of the resources that we have in the city through the Council of Aging, through the Veteran Services, to, you know, if there does become a situation in where, you know, the health department feels like they're fielding more than they can manage, that we have some kind of release valves for that to help support. And so that was an important thing for me to understand as we decided to continue to not fill that position as we kind of navigate this budget landscape. So I'm happy to answer any questions. I don't necessarily have too much more on my list, but
No, thank you. That was plenty. And, I kind of just wanted an introduction and, yeah, we're excited for the future of Easthampton. It's a lot of work to keep housing and the restaurants all moving in the right direction and
Yep.
up to code. And Ryan's doing a great job. So is everyone else.
I think so too.
Beth, did you have anything?
Just to say thank you for joining us, Mayor Derby.
My pleasure.
And I think you said you had another meeting, but thank you again for.
I do have. I'm happy to answer any more questions. I can also say, as we move into the summer, I know that it's going to get the department is going to get busier. We are looking at some events that are going to be coming up, and so I'm going to be. I think Ryan and I are going to be communicating. We have a budget meeting coming up, so we're going to be talking about how the city can support kind of making sure those operations run smoothly, and that all the summer events are able to happen within the capacity that they have. So that's going to be forefront on my mind as we enter into this next phase.
That's great. Well, thank you again.
Yeah, absolutely. My pleasure. And anytime, if you want me to come back, if you have, something you want to run by me or anything, I'd be happy to join you.
Great. We appreciate it.
Yeah, my pleasure. Yeah.
Thank you, Mayor. I appreciate it.
Yeah. Take care.
Thanks.
Bye.
Our next agenda item, number 4, is Director of Public Health update. Ryan, the floor is yours.
Thank you. Just a quick update. Our routine inspections are up to date. Chris, our inspector, was able to complete all of our lodging house inspections, which is great. Housing this month, we've had 4 emergency condemnations. A lot of it is due to no heat, frozen pipes, a couple unsanitary houses. Tobacco, Jerry's didn't contest their 3-day suspension. They were able to serve their suspension from February 12th to February 14th. They removed all tobacco products from the premises. We're just waiting on payment of the fine, and that is only because the owner is currently out of the country. I'm sure once he gets back, he'll pay that fine promptly. And the 2025 infectious disease report came out. I emailed it to both members for your review. I'm also going to get that on the city website as soon as I can. As far as flu, COVID vaccines, Northampton Shared Services is still doing homebound vaccinations for any Easthampton homebound residents that still need the flu or COVID vaccine. They can either call the Easthampton Health Department, go to our website and click on the link and just fill out a request for a homebound visit online. As far as COVID tests, we're officially out of COVID tests. So we at the health department, so we can't give out any more free COVID tests, but we still have plenty of masks. If anyone's interested in any masks, hand sanitizer, other harm reduction needs. And then just real quick, the public safety complex is always open 24/7 as a warming center if needed. The fire department and the mayor's office have done an excellent job of just getting notification out there when the temperatures are very low, that the public safety complex is always open for Easthampton residents on an as-need basis when the if they need a warm place to go. And just upcoming, as the mayor stated, and Brad will talk about it. I'm sure Brad will talk a little more, but I just want to say that Brad was able to work with the Council on Aging, Veteran Services, to set up a hopefully monthly Easthampton Human Service meeting where we'll be able to review concerns, brainstorm solutions, and just bring all of our expertise together to best serve Easthampton residents. Fiscal, like the mayor said, the fiscal 27-year preliminary budget is due next week. So I should have that to the board no later than Monday for your review. Not looking at any big changes, so it should be very similar to the 2026 budget. And then with March right around the corner, we're going to get going on getting our yearly notice out to all our summer camps and scheduling the three mandatory information sessions. And that is it as far as my update.
Great. Beth, did you have anything for Ryan?
Nope, all sounds great. Thank you.
One more thing, sorry, I just forgot real quick.
Oh, yep.
21 Love Fields. We've been working closely with the mayor's office on that. At this point, and the mayor is on board, the Board of Health is gonna pay for the remediation and bill the responsible parties. So we were able to get 4 quotes for the exterior of the property to get it completely cleaned up. We got a reasonable quote, which is $3,900. And I had a meeting with the mayor end of last week. He's on board. It's just about if the city has money to pay for it, or if we have to go through the appropriation process in front of city council. But either way, that should be happening in the near future. That property will get cleaned up.
That's great. I saw one of the neighbors the other day and they were asking for an update. It's definitely an eyesore, and who knows what kind of rodents are living under there, and that's good news. Okay, our next agenda item is the health inspector update.
All right. Hi, everybody.
Hi.
So we have same events, the same thing as farmers market is in every other Sunday at this point, and we're going about once a month. It kind of depends, but they've been doing well. So far, so good. We just all did our training today for ServSafe. So the entire department is all certified, which is excellent, including IRSA, crushed it. So that's one thing under all of our belts. In terms of inspections, kind of just like Ryan said, we're on top of all food establishment inspections. The 3-month tracker for those who need a little bit more attention, we're down to 15, so we're getting there. Just working with every establishment and educating them is the best thing, working with them to get down to where they need to be. Tobacco, we've been doing those inspections, and Ryan touched upon Jerry's. They're all set. And then for new establishments, we have the Heavy Culture Cooperative. It's a bar on Northampton Street. They're all set. I did their pre-op inspection. They look great. We also have, taking over from where the American Legion was, is Pause and Pivot Farm. They're just doing more like farm to table. They still have their pre-op inspection before they're ready to completely go, before we do that. Is there, Ferry Street, it's a convenience store, I believe. Ryan, correct me if I'm wrong. They have to fill out their plan review in order to be in operation. Is that the last one? That's the newest operation.
Correct. So just real quick, Ferry Street Package Store is closing. They sold the business. It's going to remain as a package store. It just has a new owner coming in. So they're going to do a new plan review, new application, but it's going to be the same risk level and same type of establishment.
Yep. Awesome. And then for Corsello's variants, it's approved. So they're all set. Some other establishment 7s that I've been working with, they're working on their floor. It's a very old building, so it's kind of hard to stay on top of it. I'm going to do a routine tomorrow. And then same with Old Colony, working with him. He's been able to talk with him about it, and he's been taking a lot of recommendations that we have given him. Mobile food trucks, I forgot to add this in thing I just remembered. We are getting going on those. On our website, it has all the listed ones that are approved. So those are on there. For housing, lodging's complete. We've done snow and ice violations. People love those. Making sure people's sidewalks are shoveled. So I'll get a couple calls about those, but so far so good. And then, as Ryan said too, with condemnations, I think we have 4. 1, 2, 3, 4. Yeah. So most recent one, 126 Hundred Street, was 5 feet of water. So we did that one. And then just other ones, kind of no heat, no, and water, like Ryan had said as well. Steve, for the law 37 East Street, that RV is still there. Doing my best with him. It was hard when he did get snowed in, but he comes down and he talks to me. We're trying to figure it out. We've called some places to get it off the property for him. So actively still working with him on that. 531 East Street, he has a junk removal coming for the 28th, which was another big one. So things are moving forward there. And that's pretty much the gist of it for January and February-ish.
Great, thank you. I don't have anything for you, Kelsey. Beth?
Nope, thank you for the detailed report. I appreciate it.
Number 6, the community health worker update is our next agenda item.
All right, thank you. Yeah, so, just to start off, I wanted to let you know that I'm very brand new to this. So going forward in your meetings, you'll receive my reports from Urza just like everybody else. So I'm sort of reading off a laundry list here of things, but going forward, you'll get that information in advance. Yeah, so I just, wanted to, briefly introduce myself. So I'm Brad Riley. I'm currently a professor of public health and sociology at Westfield State University, and I'm currently working towards my community health worker certification through the Commonwealth. So in my career, I've worked in a lot of nonprofit governance and advocacy roles. I'm currently the chair of Tapestry Health, which is a regional community health organization. I've worked in transitional housing services for at-risk youth, survivors of sexual and domestic violence, and families moving through eviction. And also a published author on a variety of topics, including public health impacts of state preemption on minimum wage and rent control, the intergovernmental dimensions of homelessness, and then COVID-era exigent circumstance authorities for outdoor dining, liquor licenses, and telehealth policies. And then obviously in the capacity that you all know me as a former city councilor at large here in Easthampton for 2 terms. So, I do want to be clear that my work as the community health worker for the city of Easthampton is non-appointed and uncompensated in accordance with the city charter and Mass General Law. So that is a requirement for me to not be paid in any capacity or be appointed because it hasn't been 6 months since I've stepped down as a city councilor. I intend to work and serve the city through the end of the summer while I complete my practice hours. And then I'll be in the offices Mondays and Wednesdays and occasionally Fridays and weekends as needed. So to give you an idea of what I've been working on in the last week and, kind of what's on my horizon here. So I've started doing some constituent engagement work with outside community partners. And like Director Griffin said, with the Council on Aging and Veteran Services. I've also this week started supporting the City Council in a new endeavor to design a public health intervention for improving support for our community's senior citizens and citizens with disabilities during and immediately after snowstorms. So we're kind of doing an autopsy, if you will, on the last storm and to find out what we can do to improve services going forward. Another key priority for my time with the city is to work with Director Griffin on creating an opioid abatement community of practice for how to utilize funds to support those in our community who are negatively impacted by opioid addiction. So that work as of right now is creating a framework for such a community of practice and to also have a corresponding living experience advisory board comprised of members in our community who will advise the community of practice and ensure equitable spending and restorative justice. The other piece of work that I will be looking into is the nicotine-free generation work. Haven't started that yet, but it is something that I will be looking into. I feel like that's sufficient enough for the last week. I know it's kind of a big data dump there for you. But I'm happy to answer any questions about, what my role looks like or any of the work that I'm doing. And, as always, I can be accessible to any of you. My new email account with the city is ech@easthamptonma.gov.
Thank you. That was quite the list. Thank you, Brad. You must be a busy person.
Yeah, I'm really excited that you're here. And I'm really excited about all the work you're going to be doing. That's great. It's very needed in Easthampton. So thank you for volunteering your time.
Yeah, really.
Yeah, just real quick, I just want to second what Charis said. I just can't thank Brad enough for volunteering. And a big goal of mine is for Brad, with his expertise, to set the groundwork for how this outreach role could best serve Easthampton and how it would look moving forward in the future, and to be able to provide the mayor's office as well as city council with data which supports the need for this position, because I think the community outreach position, is the face of the health department. It's the person who engages with the community, who is able to really get a feel for how to best serve the residents of Easthampton. So again, I can't thank Brad enough for volunteering his time.
All right. Thank you. I appreciate it.
That's great. Thank you, Brad. Our next agenda item is 99 East Street update. Go ahead, Ryan.
So I think we have Mr. Feldman, Mr. Rosoff here. If you guys would just mind unmuting and just providing a quick update to the progress at 99 East Street.
Do you have to maybe unmute them?
Let me see if I can try. Nope, I can't unmute him.
Okay.
Mr. Feldman, are you able to unmute? Okay, well, I can just provide a quick update. I've received some concerns from other city departments. Oh, there we go.
Hi.
Hey, Mr. Feldman, thank you for being here. I appreciate it.
Sure, we don't have visual. I guess we have audio now, but we don't have visual.
Audio's fine.
Okay, so slight hiccup. We have met with Bacon and Wilson for representation several weeks ago, but we didn't at that moment have the $20,000 retainer that they were asking. We have since taken out a mortgage on another property, acquired that, and emailed them about 10 days ago saying that we want to meet and start representation. And I'm not quite sure why it's taken so long, but apparently we have a meeting scheduled for tomorrow.
No,
for Friday, which I assume will begin the hiring process for them as representation. But I'm not certain because neither David and I can find the email, that original email. So I have to email them in the morning and ask them to resend. But I don't imagine what else it could be. So that's it. We have some court cases going on regarding this, people seeking Servpro and the original what is it? Personal adjuster seeking attachments on the payment from insurance, which are ongoing, and I'm hoping Bacon and Wilson will handle, and I can back away from it because I don't really know what I'm doing. But the only updates are, I would like to know if anybody has any recommendations for a contractor, since Andover refused to meet with our original contractor. I want to get another contractor in to submit additional estimates and see if they'll meet with him. If they meet with him, that's great. It's progress. If they don't refuse to meet with him also, it's also another minus against Andover. So if anybody has any recommendations for contractors, I'd appreciate it. We've also paid up our taxes to the city of Easthampton, and I'd like to know what the process is for getting our taxes reduced, because obviously the property's value has reduced as it's condemned. So anything else? I'm willing to answer any questions. I'll have more information after Friday, and we'll be glad to email.
Real quick, Ms. Hoffman, can you provide a quick update in regards to the temporary housing and the water? Has the water issue been resolved?
Oh
Yes.
yeah, we've got water, no problem. The only problem was during most of a week when it was so cold.
Don't understand. Almost everything that has the original plumbers who came in and do the job did not take temperature into account. So almost everything that could froze has frozen. And one by one, we spent about $350 on heat tape. One by one, we've unfrozen it. And now we think the last thing has been unfrozen. We dug out around the water pipe that came into the city, wrapped heat tape around it, insulated around it. We've heat taped everything that goes from the city to the RV. And we have water and are watching the situation and don't expect any more problems. If we do have a plumber on call, who'll come and take care of it immediately. But as of now, we have running water.
Thank you for the update, Mr. Feldman. Also, we have Building Commissioner Gardner here as well, who would just like to talk a little bit about the temporary housing and concerns that he's brought into the department's attention.
Sure, of course. Any questions?
No, you can mute yourself. Thank you.
Oh, okay. Well, thank you very much. Any other questions, please email us. I'll email any other updates.
Yeah, hi. So, I was just, this is Dave Gardner here, Building Commissioner. I was just, have been kind of watching this project for a while. It's been, I was waiting for building permit application for the repairs that need to be made, and I haven't seen that. It's been about a year now since I've been aware of this. I did hear you just speak about finding another contractor. I'm assuming that then that would lead to submission of building permit applications. Temporary housing is, according to our ordinance and according to the building permit, is only good for in building code, it's for 6 months for temporary housing, and there's typically a permit required for that. The type of housing you're currently using does not meet building code standards or city ordinance standards for manufactured housing. That's what's called for, essentially a house trailer. I believe the reason for that, and a very important reason, has to do with means of egress from a structure. If you use any structure as a dwelling, it has to meet the minimum standards for a dwelling, and one of those is 2 means of egress. But apparently that was all approved at some point, the fact that you're using a travel trailer, and spoke with Ryan a little earlier today. I don't think it's either of us would want to put anybody out, but I am anxious to see this move forward. And for me, as I said, generally there's a 6-month limitation on temporary housing. And I would like to see a permit application very soon for this project. And if there isn't one, I would like to know why, what is the hang up? So it feels like there hasn't been any progress there. And I feel like it's been long enough. There should have been something. I've never been in the house, never been asked over to have a look at what's going on. And I'm very curious about that as well. So.
Thank you, Dave.
To answer the egress issue, there are actually 4 means of egress. There's one in each bedroom and one on the opposite side from the door in the living room.
Okay, that's great. That's helpful. That's really good to know. That alleviates a big concern there. With how things are going now, and what you were describing a little earlier around representation from Bacon and Wilson and such, I mean, and when would you anticipate having a building permit application and actually begin doing repairs on the building?
Well, the primary problem here is that we got a lawyer a year and a half ago who was supposed to take care of this situation and ran into one personal problem after another, but finally got us through filing. So we had an open case, and then got disclosure from Andover sent to us after it was due. And when we tried to contact the lawyer, he completely disappeared. He made no response to us and no response to Andover. And the case was closed for lack of response. In fact, one of our reasons for acquiring Bacon and Wilson is to sue that attorney, because the case was closed because of malpractice. He just never responded to anybody. So the case has to be reopened. The original problem was there was a negotiation with Andover that we never agreed to, and they proceeded as if we had agreed to it. They never met with the contractor, which by policy they have to. We're allowed to have our own contractor review estimates and make estimates. They never met with him. They did many other things that were in complete breach of our policy. That's why I originally hired attorney Damian Martin. Unfortunately, that was a disaster and cost us about a year and a half. But I'm assuming Bacon and Wilson will be more responsible. They're certainly charging enough, and will take us to some sort of resolution. Basically, we have the option of either proceeding with rebuild, which we would really like to do, or just selling, taking whatever money the insurance offers us and selling the property. We'd have enough to move elsewhere, but we really don't want to. We like Easthampton. We like this property. If we could get these issues resolved in any sort of manner, we would be glad to do so. And that's what we're trying to do now with Bacon and Wilson. Damian Martin was a disaster and cost us, everybody, including us, a lot of time and money. That's the previous attorney.
Okay. Thank you for the update for David. Beth, did you have anything to add?
Well, is there any rule for, David, you had said that you haven't ever been to the property, but you clearly have some concerns. Is there any role for you evaluating the property just in the meantime? Because if this temporary housing, we've already exceeded the time frame, and this has sort of been an ongoing, thing that hasn't been progressing. So I don't know if there's any role for you to go and evaluate the property and see if there's any intervention that we need to do in the meantime. Just kind of spitfiring here.
Yeah, no, that's a good question. And I may not enter a property unless I'm invited. If there's a permit for work, that's a tacit invitation when you're scheduling inspections. But if Mr. Feldman were to invite me over to tour the building so I could have a look at it, that would be helpful. Otherwise, I can't really set foot on the property unless I have reason to believe that there's some imminent hazard, which I have no belief of that at this point. I mean, I'm familiar with the property because I drive by it a lot, and I have to say when I drive by it, I do sometimes slow down just to kind of see what I can see from the street. But we have other departments in town that would, like the health department, for instance, that has involvement. Fire department has concerns. They have the same kind of limitations. We can't just go into a property just because we're concerned, unless there's been a report of some imminent danger. So that's pretty much it. Preserves people's privacy, their rights, all that kind of thing. And as far as the overextended stay and the temporary housing, I think it's just, again, my thought that that's just what the regulations say. I don't want to see anybody put out or any undue hardship placed on somebody as long as they're attempting to make progress to resolve the situation. And I think that's what we're all trying to do.
We certainly don't have any problem with the visit. Just like anytime next week, you want to come over, look at the property, look at the RV, that's fine. Just let us know. That's all.
Okay, that'd be great. Excellent. Thank you.
I mean, I think just in the interest of making sure that, like, you know, we're all keeping track of everything, and everything is out in the open and transparent. Like, I think that would be great. And because we understand there are some things that are beyond your control that are happening here, but we also want to, like, if we're not following regulations to the letter, like, let's at least know that we're having this ongoing dialogue, et cetera.
It has gotten very complicated because everybody that is not being paid by Andover is responding by suing us for what Andover owes them as per our policy. So we have to respond to 3 suits at once. The suits from the PA that we unfortunately hired, a suit from Serb, who did the original fire mitigation work, who Andover refused to pay, and of course the original suit of Andover, which now has to be reopened because it was closed due to lack of attorney response. So it is very complicated. We are overwhelmed, which is why we sought out fairly expensive but attorneys with a good reputation to try and pick up that help with this problem. I don't think there's anything else we can do other than just settle and leave, which is our final option, but we'd like to avoid it if possible. Thank you.
Yeah, I appreciate everything that you guys are doing, and that you're continuing to update the board.
Dave, I don't know if you could kind of, if you do visit the property, just give Ryan some kind of assessment, or, you know, share some thoughts with him.
Say that again, what?
If you do visit the property, if you could just give Ryan some kind of update, or that he can share with us.
Yeah. And I wonder, Mr. Feldman, would it be okay if the fire department also came when I come?
I think anybody who wants to come is fine. If they need us to do anything or fix anything, just let us know. We're interested in compliance, not non-compliance.
Okay, great. I often do inspections with the fire prevention officer, and I'll get in touch with you when he's been tied up recently with a lot of commitments. When we have time, I'll get back in touch with you and see if we can come over and just walk through, and just so we can get a better sense of what the property is, what condition it's in right now, and see if we see anything that might need to be addressed, like kind of immediately, if it exists, So okay. I really appreciate the invitation. I really do. Thank you.
Okay, so we're talking about both properties, both the building that's been condemned and the RV that we're living in? I
don't necessarily need to see the RV. Captain Constantine might, but that would be up to you. I'm interested in what's going on in the house. By way of like, what are the construction needs at this point? So when I am contacted eventually by a contractor who submits a building permit application, I think it would be helpful if I have a kind of a background from walking through the building to match up the application with the needs of the building, just to make sure it's complete at this point. So an application for repairs. So.
Okay, sounds good. Again, if anybody has any contractor references, please send them to us. I would like to get another contractor to look at the situation.
Okay. All right.
Thank you.
Just real quick, just going off of what Commissioner Gardner said, my main concern is just ensuring we see progress on the property. We're coming up on the 4-year anniversary now. So if I could suggest to the board, we start the court-appointed receivership process. And if progress is being made in the next month, we could end that. But my just for the sake of time, I'd recommend we start the receivership process as it takes time, just to ensure that the property does get addressed in the near future.
Beth, what are your feelings on that? I'm okay with it.
Yeah,
What is the
yes, I think that's a good idea.
what is the receivership process?
Ryan, you can answer that, and sir, if you don't mind muting yourself after that, and Ryan can send you some literature on that you can read after the meeting.
Yeah, so I'll just answer real quick, and I'll send you more information after the meeting. But so if the owner is for any reason is either unwilling or unable to comply with the state sanitary code, the city can request from housing court that a receiver, a court-appointed receiver, be appointed, and then they would take over responsibility for bringing the property into compliance. And then once the property is into compliance, they would auction off the property. Any money that they put into the property, they would get, because they put a lien on the property, and any other money would go to other lien holders, mortgage companies, the owner. But the main thing is they would come in and they would promptly address the violations and bring the property back up to code.
Thank you, Ryan. Beth, I can make a motion if you like, or if you want to make one, I can second it.
So I will make a motion to begin the process of receivership for the 99 East Street property.
I'll second that motion. All in favor, Steve, yes?
Beth, yes.
Okay. Now we can move on to our next item 8, Board of Health Regulations Review and Discussion. Ryan, I know you wanted to speak about having an in-person hearing and anything else that's on the docket we haven't concerned yet.
Yeah, so just real quick, regards the city's short-term rental ordinance, it looks like that's getting close to being approved by City Council in the near future. So there's something to keep on your docket. There should be about 45, 50 short-term rental permits that the health department, building department, and fire preventive services will be out inspecting and hopefully permitting in the near future. And then other than that, yeah, if the board is willing, I know I really opened up a can of worms with this one a few months ago, and I've been getting emails ever since, but I would love to schedule an in-person hearing where the board can propose any changes to our current tobacco regulations and listen to Easthampton residents and Easthampton business owners, specifically tobacco establishments, on any concerns or if they'd be for or against adopting a nicotine free generation or other tobacco regulations.
Great. Beth, did you want to add anything or discuss this?
Yeah, I mean, I was going to ask about it because there's clearly considerable concern from the public. So I think that we should definitely make that a priority to have further discussion and make a decision on that. And you said in person, so is that I mean, it makes sense. It's probably going to be a hot topic with a lot of interested parties. So that's completely fine with me. And I assume that would be a separate from a Board of Health hearing. That would be a separate. Okay. I see you shaking your head. Yes.
Correct. Yeah, it would just be focused on proposed tobacco regulations. And yeah, it would be separate from our monthly Board of Health meeting.
Okay. So I am all for scheduling that. Any information that we can provide to the public in preparation for that meeting, whether it be on our Facebook page or whatever, would be really helpful, so that everyone has the information they need going into the meeting.
Yeah, definitely. I'll send a few dates, looking, I think, just to get everyone informed and then notify to all tobacco establishments as well as posting notice of the hearing, looking at mid-March towards the end of March. And I can send a few dates that City Hall is available. And if there's one that works best, I think that'd be perfect.
Yeah, great. It sounds like good next steps. See who shows up.
Yeah, that sounds good to me.
Excellent. Thank you.
Thank you.
Ryan, was there anything else for item number 8?
That's it.
Okay. Well, we can move on to item number 9, items not reasonably anticipated by the chair 48 hours in advance of the board meeting.
I was going to talk about what we just discussed, so I'm good.
Perfect. That's was on my mind too, so I'm glad we can agree on something. Ryan, is there anything else or anyone else from the department?
Nothing.
Great.
All right, so then I will make a motion to end tonight's Board of Health meeting at 6:24 p.m.
I'll second that motion. All in favor, Steve, yes?
Beth, yes.
Great.
And thank you, Steve, for running the meeting for me. I'm just a little out of sorts right now.
Yeah. Well, I wish you a speedy recovery.
Thank you so much. Thank you, everyone.
This government meeting is brought to you by Eastworks and our local cable subscribers.